Yeah. So yes. Good evening. Good evening, Aditya. Good evening. Good evening. Yes. Welcome to the session on the anatomy of the esophagus. This side, Dr. Abhijit. Yes. So let us learn about the anatomy of the esophagus today. Yes. Sushantika, good evening, beta. Rahmatullah, good evening, beta. Sai Krishna, good evening. Sethi Osman, good evening. Dimple D, good evening. Good evening, beta. I hope the audio and visuals are perfectly fine. So yes, before starting the session, as I always do, beta, just give me a thumbs up in the chat box that the audio and visuals are perfectly fine. Sayyid, yeah, good evening, beta. Ishraq, good evening. Yeah, okay, perfect. Julius, good evening. Kapil, good evening. Vicky, good evening. Mohammed Sharjil from Pakistan. Okay, beta. Good evening. Good evening. Sanya. Okay, perfect. Perfect, beta. Let us start the session without wasting much more time. Yes, Hazira, good evening. Garima, good evening, beta. Welcome to the session on the anatomy of the esophagus, where I will be discussing each and everything, the length, beginning, termination, the course, constrictions, the anatomy of the sphincters, okay? And obviously, in every GIT part, I always discuss the arterial supply, the venous supply, okay, the nerve supply, and obviously the lymphatic drainage. Apart from that, I will be discussing the clinical correlation over here. Yes, good evening, Kriti, good evening, Bhola, good evening, Tebe, Usman. Usman, you have to go to the Telegram to get the notes, okay? So let us now start with the esophagus, beta. The Telegram link will be shared, okay? Yeah, will be shared with you. Yeah, it is just there on my screen, beta. It is just there on my screen. You can join that Telegram group. Nitika, good evening. So, beta, remember that esophagus. Yeah, esophagus. It is one of the narrowest. Okay, it is one of the narrowest, and yeah, it is one of the narrowest and most muscular parts. Okay, it is one of the narrowest and most muscular part of the digestive tube or the GIT tube, okay, of the digestive tube, okay. So remember, beta, it is the narrowest part and it is the most muscular part, okay. Yes, this is S. It is the most muscular part of the digestive tube. Moreover, you have to remember that the lumen of this esophagus only opens during deglutition. Okay, yeah. Welcome, Julius, to the class. I hope this will benefit you a lot. Coming on to the length of the esophagus. So remember the length of the esophagus. It is approximately around 25 centimeter, or in other words, I can say it is 10 inches. Okay. So the length of the esophagus, it is approximately 25 centimeter, and yeah, which is equal to 10 inches. Now, where is the beginning point? Can anyone tell me in the chat box from where is the beginning point of this esophagus? Yes, it begins in the, yes, very good, Peta. It begins in the neck. Okay, it begins in the neck, and you already know in the neck, yeah, what it is. It is the lower border of C6. It is the lower border. Yes, Kapil, very good. It is neck only. It is the lower border of C6. What is C, beta, over here now? What is C? Can anyone tell me what is C over here? Lower border of C6. Chalo, I want to test your brains right now, and I want the answer over here in the chat box. The lower border of the C6. नहीं 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 नहीं, सब 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 एक जैसा ही आंसर लिखते हैं. हाँ, ठीक है. हम्म. चलो, वेरी गुड, वेरी गुड. Yes, Alhadita, this is all in detail. I am all already the students who are with you, they are in the first year. No need to, yeah, worry. ठीक है. Beta, lower border of the C6. Apart from that, you have to remember, beta, it is the, yeah, lower border of cricoid cartilage as well. It is the lower border of cricoid cartilage as well, right? Okay, and it is a downward continuation of pharynx. It is a downward continuation of pharynx. ठीक है, सबका ठीक है. तो एक चीज आपको याद रखना है, it is lower border of C6, it is lower border of the cricoid cartilage, and it is downward continuation of pharynx. So these 3 points you have to remember, beta. Okay, these 3 points: in the neck, lower border of C6, right? Lower border of the cricoid cartilage, okay? Cricoid cartilage, and continuation of pharynx. And continuation of pharynx. Satyashri, good evening, beta. Good evening. Now, when we talk about the termination, beta, coming on to the termination part, so anyone can tell me where it terminates? Already I have discussed it in the stomach part. Okay, terminate. Termination बताइए जल्दी से chat box के अंदर. Yeah, tell me the termination part. I'm waiting for your answers, guys, in the chat box. चलिए, it is in the, yes, very good Usman, not the abdominal aorta. Obviously, it is the abdomen. Yeah, it is in the abdomen, right? It is in the abdomen, and you already know it is immediately below the esophageal opening of the diaphragm, right? Yeah, yes, very good, very good. It is immediately below the esophageal opening of the diaphragm. Esophageal opening of diaphragm. Yes, doc APF, you have typed T10. Okay, very good, beta. You should remember it is, if we are talking about the esophageal opening of the diaphragm, as doc APF has already written, it is opposite the lower end of T10. Okay, lower end of T10, and it is by joining which end of the stomach, guys? I want the answer. By joining which end of the stomach? चलिए इसका आंसर दीजिए. By joining which end of the stomach? नहीं, एपिगैस्ट्रियम कैसे हो जाएगा? कौन सा एंड होगा बेटा? फटाफट से बताओ चैट बॉक्स के अंदर. Which end of the stomach? Yes, Sethi Osman, very good, beta. By joining the cardiac end of the stomach. Okay, by joining the cardiac end of the stomach. Yes, by joining the cardiac end of the stomach. Yes, very good, very good. Kapil, Parna, Sushantika, Garima, very good, beta. Yes, by joining the cardiac end of the stomach. Yeah. Now, coming on to the parts of the esophagus, guys, coming on to the parts of the esophagus. For example, let us just assume that the esophagus is like the continuation of the pharynx. Yes, it is the continuation of the pharynx, and it is a narrow tube which contains muscles. Okay, the most muscular part of the GIT, the most muscular part of the GIT. Okay, now everyone knows that this junction, okay, this is pharynx above, and this junction between the pharynx and the esophagus, it is called as the, yeah, can anyone tell me the name? It is called as the pharyngeo. It is called as the pharyngeo-esophageal junction. It is the pharyngeo-esophageal junction. Okay, it is continuation of the pharynx, so it is the pharyngeo-esophageal junction, and it is present at level of C6. Okay, it is present at the level of C6. Okay, now the esophagus, beta, it is divided into how many parts? Type in the chat box, beta. The esophagus is divided into how many parts? I want the answers from you people. The esophagus is divided into how many parts? Now, yes, Sethi Usman, very good. Anushka, very good, beta. We have, yeah, Perfect. Perfect, beta. We have three parts of the esophagus. Very good, beta. We have three parts of the esophagus. Yes. Chalo. Very good. Aditya, Sharjeel, Doc, APF, Satyashri, Miriam, Dimple, Garima. Very good, beta. Very good. We already know we have three parts of the esophagus. So I'm just highlighting those three parts right now. Yeah. So remember, this is part one. Okay, this is part one that I am just trying to show you. Yeah. Now this part, it is called as the cervical part of the esophagus. Okay, it is the cervical. Yes, very good, Naresh. Very good, beta. It is the cervical part of the esophagus, and you already know the cervical part of the esophagus. It is approximately beta 5 centimeter. Okay, it is approximately 5 centimeter, and it is present in the lower part of the neck. Okay, it is present in the lower part of the neck. It is present in the lower part of the neck. We have the cervical part, that is the first part of the esophagus. Okay, this is the first part of the esophagus. I hope this is clear. Chalo, coming on to the second part. Can anyone tell me the name of the second part, beta? Can anyone tell me the name of the second part? Yeah. चलिए आंसर दे दीजिए सेकंड पार्ट वाला. Yes, the second part of the esophagus, yes, it is lying in the thoracic part, thoracic region, right? So it is called as the thoracic part of the esophagus. Okay, it is the thoracic part of, देखो गला, when we are talking about the neck, we have the cervical region, right? Beyond the neck, we have the thorax region. So the second part will be the thoracic part. Yes, very good, Kriti, very good, Satyashri, very good, Usman, very good, Pita. It is the thoracic part of the esophagus. Right. It is the thoracic part of the esophagus, descending first in the superior mediastinum and then in the posterior mediastinum. So you should remember it is descending first in superior mediastinum and then in the posterior mediastinum. Now, can anyone tell me the last part of the esophagus, which is present just below the diaphragm, beta? The last part of the esophagus that is just present below the diaphragm. Yeah. Yes, very good, beta. Naresh, very good. It is abdominal. Yeah. The cardiac end. Yes, abdominal, abdominal, abdominal. Very good. Everyone is right, beta. The third part that you all have to remember, it is the abdominal part of the esophagus, or it is the abdomen part of esophagus. Okay, so it is the shortest one. Okay, it is the shortest one, and remember it is only 1.5 inches. Okay, it is 1.5 inches, like approximately 3 centimeter, 3 through 3.5 centimeter, right? So yes, yes, yeah. And remember, this is the abdominal part of the esophagus. It is below the diaphragm. It is below the diaphragm. So remember that this structure that I have drawn, it is the diaphragm. It is the diaphragm. So I hope this is clear to everyone. Just give me a thumbs up in the chat box that all the three parts are clear to everyone. All the three parts are clear. The cervical part of the esophagus, the thoracic part, and the abdomen part of the esophagus. Yes, Aditya, very good beta. Shiv सही था आंसर, सबका आंसर सही था. Angel Matthews, very good. Anushka, Sharjeel, Dimple, very good beta, very good. यस बेटा उस्मान, लेक्चर का नोटिफिकेशन आता होगा टेलीग्राम पे. आई हैव नो आइडिया, अदरवाइज यू प्लीज सब्सक्राइब टू द चैनल और बेल आइकन प्रेस कर दो, सो इट विल बी एन इजियर वे टू नो गेट द नोटिफिकेशन. या सत्यश्री, गरिमा, कृति, सुशांतिका, very good beta, perfect. Now I hope the parts of the esophagus are very much clear now. बेटा लेंथ ऑफ द थोरासिक पार्ट आप खुद दिमाग लगा लो. 5 ऊपर हो गया, 3 ये हो गया नीचे. टोटल लेंथ कितनी थी? नाउ यू आर गोइंग टू आंसर मी. thoracic part, it is the longest part of the esophagus, right? It is the longest part. So yes, remember it is the longest part, and you are going to tell me if the total length of the esophagus is 25 centimeter. ठीक है, 25 में से 5 ऊपर सर्वाइकल हो गया, नीचे एब्डोमेन 3 to 4 सेंटीमीटर हो गया. व्हाट इज द लेफ्ट पार्ट ऑफ द thoracic now? What is the left part? So you are going to answer me. चलो, छोटा सा होमवर्क है, फटाफट से कर लो. Now coming on to the constrictions of the esophagus. Now coming on to the constrictions of the esophagus. Again, to understand this, let us just draw this diagram. बताते जाओ आंसर इसका. मेरा टोटल लेंथ, हाँ अप्रोक्सीमेटली 18 to 19. हाँ ठीक है, वैरी कर सकता है. हाँ चल. Now constrictions in the esophagus. Can anyone tell me what is the number? Yes, Hussein Amidu, very good beta. It is 3. It is 3 in number. But before that, let us just try to draw the image so that it's clear to you. The constrictions in the esophagus. Now we already know the esophagus. It is continuation of the pharynx, right? Yeah. Now we have 3 constrictions in the esophagus. Yes, everyone is right. Satyashri, Aditya, very good. We have 3 constrictions in the esophagus. So, right, I'm not focusing on the, yes. So, yes, remember beta, suppose this is the diaphragm. Now, suppose this is the diaphragm, right? Now tell me beta, this is which junction beta? This is pharyngeal-esophageal junction. Now, pharyngeal-esophageal junction, it is, yeah, at the level of C6. It is at the level of C6. Now, it is at level of C6. Now, beta, there are 3 important landmarks. Okay. Now, before coming exactly to the constrictions, there are 3 important landmarks, beta. There are 3 important landmarks. Yeah. Now, the very first one, beta, if we take from upper incisor, okay, this is the first constriction that will appear. Now, it is 15 centimeter. Okay, it is 15 centimeter from upper incisor. Okay, from the upper incisor, if we take 15 centimeter, there will be the first constriction of the esophagus that is exactly present at the pharyngeo-esophageal junction. Okay, it is present at the pharyngeo-esophageal junction, just beginning in the neck. Okay, just it's beginning in the neck, right? So it is 15 centimeter from the upper incisor. Can anyone tell me why like there are 3 landmarks that are taken? Okay, 15 centimeter. Then from the upper incisor, like if we take, yeah, if we take 25 centimeter, and from the upper incisor, if we take approximately 40 centimeter. So the three constrictions are present at this much distance from the upper incisor. Now my question is, okay, now let me just write the constrictions over here. So the first constriction beta that I have already mentioned, and you already know it is in the beginning of the neck. Beginning in the neck, and when I say beginning in the neck, it is like 15 centimeters from the upper incisor, just exactly opposite at the pharyngeal-esophageal junction. Beta, it is these constrictions are the most common site where any foreign body, kabhi kabar, for example, a child no take something in his mouth, okay, और वो जाके stuck हो जाता है, it gets stuck into the esophagus. So there are 3 points beta, okay, the operating surgeon will see कि ये 3 points कौन से हैं where it can get stuck. So these are the 3 constrictions in the esophagus. Okay, that is why like these landmarks are very very important. Like 15 centimeter will get the first one, 25 the second one, and the 40 is the third one, right? So it gives an hint or an idea that the foreign body which the child has consumed, it can be at these particular places, right? So I hope this particular point is clear to everyone, right? So it is beginning in the neck. The second one beta, it is beginning in the neck at the second one, it is at the site where it is crossed by the left main bronchus. The left main bronchus. Okay, the second constriction, it is where the esophagus is compressed by the main bronchus, or I'll just try to draw it like this. Yes, so this is like the left main bronchus, and it will not try to compress the esophagus. So yes, this is the left main bronchus. Yes, and it is the second site where the esophagus is constricted. It is the second site where the esophagus is constricted. Yeah, everyone can see. Can everyone see in this particular picture, beta? Yeah, so it is the main bronchus which is now constricting the esophagus behind it. Okay, and over here you can also get the arch of aorta also. In some books it's written arch of aorta. So you can see the arch of aorta coming above like this. So yes, arch of aorta can also be present over here, which can contribute to this constriction in the esophagus. Okay, so yes, this is the arch of aorta coming like this, right? So this is arch of aorta. Arch of aorta. So second constriction, it is the site where it is crossed by the left main bronchus. Okay, the left main bronchus. चलिए इतना क्लियर है. चलो now beta, third site, can anyone tell me the third site? And it is way clear because I have already drawn it. The third site, can anyone tell me the third site in the chat box? बताओ आंसर थर्ड साइड का क्या होगा. मैंने ऑलरेडी बना दिया है. Yes beta, the third site, it is the, yes, tell me anyone. Abdominal. अच्छा पहले वाला आंसर दिया है. नहीं, it is the lower end of the esophagus where it passes through the diaphragm. Okay, the lower end of the esophagus where it passes through the diaphragm. Second वाला point ये था, third ये हो गया. So the third, it will be the lower end, the lower end as it passes through diaphragm. Okay, as it passes through the diaphragm. Very good, Sharjeel, very good. Usman, very good. Chalo. I hope this is clear. All the constrictions are clear, and their Location is clear. 15 centimeter, 25 and 40 centimeter. I hope, just give me a thumbs up in the chat box, guys. The constrictions are clear. Okay. Just give me a thumbs up in the chat box that the constrictions are clear, the parts are clear, the length, beginning, termination is clear. Now coming on to the sphincters part. Sai Krishna, very good. Sushantika, Aditya, Satyashri, Sanjana, Surveen, very good. Very good, beta. Now, very good. Coming on to the next part, beta. Coming on to the next part, that is the esophageal sphincters. Okay. So remember, yeah. Shali, Anushka, Usman, very good. Karima, very good. Now, the esophageal sphincters are basically divided into two categories. Okay. They are divided into two categories. The first one that you have to remember, it is the upper esophageal sphincter, and the second one that you have to remember, it is the lower esophageal sphincter. Now guys, tell me, now when I say upper esophageal sphincter is both anatomical and physiological, what does it mean? It is both anatomical and physiological entity. I've already explained you this point. Both anatomical and physiological entity. So yes, can anyone tell me what does it mean? So everyone knows that, beta. Anatomical sphincters. Yes, anyone? Are areas of, yes, are areas of narrowing, and physiological sphincters. Yes, physiological sphincters are areas of high pressure. Yes, it is having areas. Because of circular muscles. Very good, Anushka. Yeah, constriction. Varun Kashyap. Very good, beta. Physiological sphincters are areas of high pressure. Areas of high pressure. Very good. So the upper esophageal sphincter होगा और एक बिल्कुल lower part पे होगा, the lower esophageal sphincter. Now beta, upper esophageal sphincter is both anatomical and physiological. Area of narrowing भी है और it is having a high pressure also, right? Now, as Anushka rightly said, it is formed by two portions of inferior, yes, two portions of inferior constrictor muscle. It is formed by two portions of inferior constrictor muscle. Now, can anyone tell me lumen pressure is high. Can anyone tell me the two inferior constrictor muscles which are present over there? Yes. Now, beta, you should remember that we have two muscles which are obliquely placed. Okay. Yeah. And one muscle which is vertically placed. Huh. Yes, Varun Kashyap, very good. It is the, yes, नहीं, हाँ, thyropharyngeus है, which is obliquely placed. So we have the thyropharyngeus, right? Thyropharyngeus. And we have one muscle which is vertically placed over here. It is the cricopharyngeus. Cricopharyngeus. Okay. So yes, it is thyropharyngeus only. So I'm not writing it again. And remember, beta, the potential space between these two muscles, potential space, again clinical correlation between these two muscles, beta, it is called as Killian's dehiscence. Okay, it is called as the Killian's dehiscence, dehiscence, right? It is called as the Killian's dehiscence, and beta, remember, it comes out as Zenker's diverticulum. It comes out as Zenker's diverticulum, right? This is again an important question. Okay, it comes out as Zenker's diverticulum. We will discuss this a bit later. So yes, you should know. Yeah, upper esophageal sphincter. Upper esophageal sphincter. It is like both anatomical and physiological area of narrowingly present और constriction हो के obvious सी बात है और high pressure होता है यहाँ पे, ठीक है? Now Now coming on to the lower esophageal sphincter, yes, it is a false diverticulum. Even beta, this time they have asked a question, and I want you to write it somewhere in your notes that the esophagus, the esophagus basically lacks serosa. Okay. Now this was the question they have asked in this FMG exam. The very simplest question I would say, the esophagus lacks serosa. And remember beta, what is the strongest layer of esophagus? Can anyone tell me what is the strongest layer of the esophagus? Strongest layer of the esophagus? Anyone who would like to answer? Yes, it is the submucosa. It is submucosa. These are two potential questions. One they have already asked in this FMG exam. This July they have asked this. Yes, it is the submucosa beta. Yes, very good. Very good, very good. Apart from that, coming on to the anatomy of the lower esophageal sphincter, beta, remember firstly that it is only a physiological entity. Only a physiological entity. Now, when I say physiological entity, beta, you should remember it is area of high pressure. Okay, it is area of high pressure. It is area of high pressure. Yes, Turbine, Aditya, very good. It is area of high pressure. Now, what is the pressure over here? Can anyone tell me what is the pressure over here? What is the pressure in the lower esophageal sphincter? This is again an important question. What is the pressure here in the lower esophageal sphincter? Pressure in the lower esophageal sphincter. Anyone would like to guess? Now, it is approximately 8 to 25 mm of Hg. It is 8 to 25 mm of Hg. Yes. Now, lower esophageal sphincter, we can also write it as LES. Okay, we can also write it as LES. So the pressure over here, it is 8 to 25 mm of Hg. Now beta, there can be two situations over here, two clinical correlations that you can see over here. If this pressure, okay, if this pressure of the lower esophageal sphincter, okay, if okay, or I can say if the lower esophageal sphincter relaxes too frequently, it results in a disease called as the gastroesophageal reflux disease. Gastroesophageal reflux disease. Now, whereas if we talk about if it does not relax, your sphincter relax in your eye. It does not relax, then it will result in a condition called as, okay, now if it does not relax, what will happen? Will it allow the food particle to go down? बेटा अब now you tell me in the chat box, will it allow the food particle to go down? If it is not relaxing, अगर relax नहीं हो रहा है, तो obvious सी बात है, it will not allow the food particle to go down. So yes, no sir, very good, Srijal, very good, Aditya, very good. It does not allow, beta. It does not allow food to go down. Food to go down. Yes, and this is called as eclasia cardia. This is called as eclasia cardia. अब रिलैक्स कर गई है फ्रीक्वेंटली बहुत ज्यादा, अब आपको पता है व्हाट विल हैपन, द कंटेंट्स फ्रॉम द स्टमक विल कम इनटू द esophagus, so that is gastroesophageal reflux disease. So that is due to this lower esophageal sphincter pressure, beta. Lower esophageal sphincter pressure. Now can anyone tell me this lower esophageal sphincter pressure, how many factors does it, like how many factors are responsible for maintaining it? How many factors are, yeah, vomiting will occur. We will discuss these two conditions in clinical anatomy. No need to worry about this. I will discuss the foreign body impaction and these two conditions, so absolutely no need to worry over here. I will be discussing GERD and eclasia cardia. No need to worry. But before that, let us just discuss about the anatomy, core anatomy first, beta. So you guys are going to tell me how many factors are responsible for maintaining this lower esophageal sphincter pressure. Now, let me just draw a diagram for you people. Okay. Sure. You already know that this is the diaphragm. So this is the diaphragm. Yeah. Now over here we already know that the esophagus is coming, right? Okay, I'll just draw a hole in between that. Yeah. So this is the diaphragmatic opening through which this esophagus is coming. Yes. हाँ, esophageal varices ये सब अभी हम डिस्कस करेंगे बेटा, बहुत सारी कंडीशंस होते हैं शर्जिल, नो नीड टू वरी, I'll just come on to everything, but let us discuss it one by one. Okay, so yes, ठीक है, क्या है इस पे वो करना है now. Now beta, the most important factor over here, okay, the most important factor over here beta, it is the length of the intra-abdominal esophagus. Now you guys are going to tell me what is the length of the intra-abdominal esophagus. Now the first factor that I'm going to tell about, it is the length of the intra-abdominal esophagus. The length of the intra-abdominal esophagus. So yes, can anyone tell me what will be the length of the intra-abdominal esophagus? जल्दी से बताओ, जल्दी से. बताओ 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 कितना लेंथ होता है बेटा, सारे बिल्कुल चुप बैठ गए हो. आंसर हद हो गई, मतलब वेस्ट, यू गाइस आर नॉट आंसरिंग द क्वेश्चंस. एब्डोमिनल पार्ट ऑफ इसोफेगस 1.5 इंचेस अप्रोक्सीमेटली हो गया 3 to 5 सेंटीमीटर्स, राइट? अभी बताया, यस अनुष्का, वेरी गुड बेटा, अभी जस्ट पढ़ाया एक स्लाइड पहले ही. इट इज 3 to 5 centimeters beta. Now remember beta that yes, yeah, this is the most important it is the most important factor which helps in maintaining which helps in maintaining the lower esophageal sphincter, or it prevents reflux, or it prevents reflux. So that is the most important factor which helps in maintaining the lower esophageal sphincter or helps in the prevention of the reflux. Okay. Now the second factor, beta, the second factor, it is the angle of the hiss. Okay, this is the angle of hiss. Now it is also called as the gastroesophageal angle. Gastroesophageal angle. Yeah. So yes, the narrowing of this angle will, the acuteness of this angle will actually prevent the reflux. Okay. The second most important factor. The third factor that you have to remember, beta. Yes, I don't have space down, so that's why I'm writing it over here. The third one, it is the pinching effect of the right crura of the diaphragm. It is the pinching effect of the right crura of the diaphragm. Okay, so right crus and the left crus. So it is the right crus of the diaphragm which actually narrows it. Yeah. So yes, and the fourth one has the least contribution, beta. It is the arrangement of the gastric folds. Arrangement of gastric folds. And remember, it has least contribution. It has least contribution in maintaining the patency of lower esophageal sphincter. In maintaining patency of lower esophageal sphincter. So there are four factors, beta, that help in maintaining the patency of the lower esophageal sphincter. The length of the intra-abdominal esophagus, 3 to 5 centimeter. If this length is short, okay, if it is short or less than 2 centimeter, beta, it can result in a condition that is called as GERD. If the pressure is less than 6 mm of He and the length is less than 2, it can result in GERD. The second most, it is the angle of the hiss. The third, it is the pinching effect of the right crura of the diaphragm. And the fourth one, it is the arrangement of the gastric folds. Okay, arrangement of the gastric folds. Okay, so I hope the lower esophageal sphincter, you have to remember the pressure. The takeaway points are the pressure, okay, and the two conditions that can result if this lower esophageal sphincter patency is not maintained. If it relaxes too frequently, it is GERD. If it does not relax, it will not allow the food to go down. That can result in eclasia cardia. So everyone just give me a thumbs up in the chat box if the anatomy of the lower esophageal sphincter, the upper esophageal sphincter is clear, the constrictions are clear, the parts of the esophagus are clear, the length, beginning, termination, everything is clear. Yes. Surely. Very good. Aditya, Sanjana, Satyashri, Veer, Sai Krishna, Angel, Kriti. Very good. Surveen, very good. Very good, beta. Kapil, Sushantika, very, very good, beta. Very, very good. Yes. Hmm. Sure. Sethi Usman, Sharjeel, Dimple, Vicky Chaudhary, very good. Now let us discuss the arterial and venous drainage of the esophagus. Now, once like we will discuss this in one slide only. Now, what I have done in this part, we can okay, now since I will be explaining this in one particular slide, so let us just draw a table over here. Where you should remember that the esophagus is having a segmental blood supply. Okay, it is having a segmental. Now, how many segments of esophagus are there? Tell me in the chat box. It is having a segmental blood supply. So yes, it is having a segmental blood supply. चलिए फटाफट से बता दो. 3 है. उदय किरण, वेरी गुड. कृति, वेरी गुड. 3 पार्ट्स है, तो ऑब्वियसली बात है हम इसको 3 पार्ट्स में डिवाइड करेंगे. ऑब्वियसली बात है वी विल या हाँ, हम इसको 3 पार्ट्स में डिवाइड करेंगे. तो पहले मैं टेबल बना देता हूँ और मतलब उसके बाद फिर हम लोग डायग्राम से इसको फिल करेंगे, खुद से ही फिल करेंगे. So yes, you already know we have the upper 1/3 part. When I say upper 1/3 part, so I'm actually talking about the cervical part of the esophagus. The cervical esophagus. Okay. Then we have the middle. Yes, middle or thoracic esophagus. Middle or thoracic esophagus. And at last, we will have the lower part of the esophagus or the abdominal part. Lower or abdominal part of esophagus. It is beta lower 1/3 लिख लेना. Yeah, it is. Yes, everyone is right. हाँ बिल्कुल बेटा, ब्लड सप्लाई में दोनों ही चीजें मेंशन करनी होती है. इट इज always necessary to read the question. Arterial and venous drainage, arterial supply, venous drainage, पूरा आपको ये पूरा बताना है. Whatever I will draw on this slide and whatever I will write, it is like more than sufficient. It is lower 1/3 or abdominal part of esophagus, and better if you draw flowcharts better. It is like it will be a piece of cake. So yes, we will be talking about the arteries. Yeah, arteries which are supplying it and the veins which will be draining it. So are the arteries and the veins. I will be writing and you will help me in filling this particular table. You will help me in filling in this particular table. Now let us just try to draw this diagram. You already know the esophagus. It is like continuation of the pharynx and like it is a big 25 centimeter tube. Sure. Now, if we talk about the first part, beta, can anyone tell me the cervical part of the esophagus is receiving the blood from which artery? Okay, it is receiving the blood from which artery? Okay, my next question is Uday Kiran Kriti, very good. Inferior thyroid artery. अब मेरे क्वेश्चन का आंसर तुम लोग दोगे. Inferior thyroid artery is a branch of. चलो, if I just want to draw this inferior thyroid artery over here, yeah, let me just draw this. Yes. So yes, I have this inferior thyroid artery. Yes, it is a branch of subclavian. Subclavian. Very good. Varun, Garima. So this inferior thyroid artery will supply the cervical part of the esophagus. And this inferior thyroid artery, I will write it like this. Inferior thyroid artery. So everyone knows this. This is the cervical part. So yes, fill the table simultaneously, beta. You will learn it. It is the inferior thyroid. It is the inferior thyroid artery. Now, everyone is right. Can anyone tell me? Yeah. Which veins will drain the cervical part of the esophagus? Yes, जो artery का नाम है बेटा. Yes, which veins will drain the cervical part of the esophagus? Yes, which veins will drain? Yes, Kriti, very good beta. It is the inferior thyroid veins. It is the inferior thyroid veins. Yes, we have the, very good. We have the inferior thyroid veins. Now I want your answers. Inferior thyroid veins will drain the blood into what? Inferior thyroid veins will drain the blood into which vein? Hmm, ठीक है, इननॉमिनेट वेन्स हैं, हाँ, बट उससे पहले भी कुछ मिसिंग है. उससे पहले भी कुछ मिसिंग है. फटाफट से आंसर बताओ भाई, सबके सब बैठे मत रहो. Now coming on to the second part, so you already know, we have already discussed beta the, yeah, we have already discussed the cervical part of the esophagus, right? Now coming on to the thoracic part beta. So this yellow one, it is the cervical part of the esophagus. This is the cervical part of the esophagus. Now दूसरे वाले में बता दो. ओके, दूसरे वाले में बता दो which abdominal वाले, सॉरी, thoracic वाले रीजन में, yeah, which artery will drain, which artery will supply the blood to the thoracic part of the esophagus? Which artery will supply the blood to the thoracic part of the esophagus? Yes. हाँ, very good, very good. बता दो आंसर जल्दी से. So you already know we have the, बेटा thoracic region है, दिमाग लगा लो थोड़ा सा. Thoracic region है. Yes, we have the thoracic aorta. We have the thoracic aorta, or especially if we say it is the descending thoracic aorta. Okay, these are the descending thoracic aorta. So these are descending thoracic aorta. Okay, direct branches from the descending thoracic aorta, and apart from that, yes, it is the bronchial arteries which will supply the blood. Okay, it is the bronchial arteries which will again supply the blood. Bronchial arteries. Okay, so in the middle part we have the descending thoracic aorta. Meanwhile, just type the answer for the venous drainage in the, yeah, descending or descending thoracic aorta plus the bronchial arteries. Yes, and the venous drainage. Yes, the venous drainage, it is by, yes, yes, or most precisely beta, if you want, you can just make this bronchial arteries and a little bit over here. Okay, this is just coming from the side. Yeah, so yes, so we have these bronchial arteries. So these are also like supplying the blood to the middle or the thoracic part. Yes, esophageal system of veins, very good. Parna, Kriti, Amulaya, very good beta. It is the esophageal system of the veins, and you should remember beta, we have the hemiesophagus and esophagus. Both veins will, like, yeah, hemiesophagus and esophagus. Yes. So yes. So this is the hemiesophagus vein. Okay, and over here we have the azygous veins. Okay? Azygous veins. So yes, azygous veins. So yeah, so the venous drainage in the middle or the thoracic esophagus, it is by the hemiazygous plus azygous veins. Azygous veins. Now guys, now tell me the third part beta. Third part below the diaphragm वाला जो part है. तो ये second part तो clear हो गया है suppose. जल्दी से एक thumbs up दे दो कि second part clear हो गया है sir. You are already aware about the second part of the esophagus, that is the thoracic part. हाँ चलो ठीक है. आदित्य संजना very good बेटा. Now again coming on to the third part. Yes, again coming on to the third part. That is the abdominal part of the esophagus. और इसकी बता दो artery एक ही रहेगी, same रहेगी artery. और ये this I have discussed in the, yeah, this I have already discussed. Yeah. Hmm. Hmm. Now you already know beta, this I have already like focused over here. Everyone is right. Left gastric artery होगी. Left gastric artery की कौन सी branches है? जरा कष्ट करो बताने का. Suppose this is the stomach part, right? तो ठीक है, stomach पे नहीं जाएंगे हम लोग. I'm like not so much care about the stomach. Yeah. So left gastric artery. Yeah. Which branches of the left? Yes, Kriti, very good. Very good, beta. It is the esophageal branches of the left gastric artery. Very good, beta. It is the esophageal branches of the left gastric artery. ठीक है. So you already know we are just talking about this part, and yeah. So yeah, we have this abdominal aorta. We have this. सब क्लियर कर दूंगा. Abdominal aorta, and abdominal aorta which is giving a branch to supply the lesser curvature. Okay, it is called as the left gastric artery. Left gastric artery, and this left gastric artery is giving esophageal branches. Okay, so this is the esophageal branches of the left gastric artery. Okay, it is the esophageal branches of the left gastric artery. इतना क्लियर है. एब्डोमिनल aorta से लेफ्ट gastric artery निकलती है, and this left gastric artery is giving esophageal branches. Yes, everyone is right. Yes. Now इसी abdominal aorta से एक branch बेटा और निकलती है, which is supplying the lower end of the esophagus as well, and it is like supplying the diaphragm. So can anyone tell me which branch? Yeah, everyone has written already. Yes, beta. It is the phrenic artery, and yeah, it is the left phrenic artery. Very good, beta. So it is the phrenic branch. Okay, it is the phrenic branch. Okay, coming from the, yeah, it is the phrenic branch coming from the abdominal aorta, and more precisely, it is the inferior phrenic branch. Apart from that, if we talk about the veins, so remember we have the, yes, we have the left gastric vein. We have the left gastric vein, right? We have the left gastric vein. So the lower 1/3 of the esophagus, remember that we have the esophageal branches of left gastric artery plus inferior phrenic artery. And you already know inferior phrenic artery, it is direct branch from abdominal aorta. It is the direct branch from the abdominal aorta. Okay, it is a direct branch from the abdominal aorta. And if we talk about the vein, it is the left gastric vein. Okay, it is the left gastric vein. I hope this blood supply is clear to each and everyone, beta. I hope this blood supply it is clear to each and everyone. Just give me a thumbs up in the chat box. Meanwhile, I'll just label it that this is the yeah middle part. Middle part. Yes, Aditya, very good. And this is the lower part. The lower part of the esophagus. Yes, Aditya, Amulya, Sanjana, Angel, very good, beta. I hope Veer Doshi, very good, very good. Yes, okay, perfect. So I've discussed the arteries and veins in one particular diagram and in one particular table. So it's just one takeaway slide, and that is something which I would ask everyone to mark a dollar sign over here. So that yes, this is important. So that is you have to like pay attention to. Okay? Yes. Chalo, very good. Satyashri, Anushka, Garima, Vicky, very good. Very good, beta. Now, coming on to the lymphatic drainage, beta. So, this is something that we have already drawn. Now, coming on to the lymphatic drainage, beta. Lymphatic drainage. So, remember, again, this is, you all have to remember, the lymphatic drainage is also like, it has a segmental drainage. Now, when I say segmental drainage, each part will drain into different group of lymph nodes. So if we talk about the cervical lymph nodes, okay, the the cervical part. So remember, it will drain into the cervical, or more precisely, it is the deep cervical lymph nodes. Deep cervical lymph nodes. Okay, it is the deep cervical lymph nodes. Yes, made it easy. Okay, beta. The thoracic part, yeah, the thoracic part, it will drain into beta bronchial artery. So we have the bronchial lymph nodes. Okay, we have the bronchial lymph nodes. Okay, yeah, we have the bronchial lymph nodes. Yes, and pre-aortic. We have pre-aortic group of posterior mediastinal lymph nodes. You can draw this diagram as well. So yes, and below the abdominal part, beta, that you have to remember, it drains into the pericardiac group of left gastric lymph nodes. Left gastric lymph nodes. Just according to the location beta, you will get the lymph nodes drainage also. So it's way easier beta. Okay. I hope everyone has written this. I hope everyone has written this. The lymphatic drainage. Yeah, everyone has written this. The lymphatic drainage. Shall. Coming on to the next part, that is angel, very good beta. Coming on to the nerve supply. So in the nerve supply beta, remember again, it has a segmental nerve supply. So can anyone tell me which nerve supplies the esophagus? Yes, the esophagus is richly supplied by the autonomic nerves. Yeah, which form esophageal plexus. So it is richly supplied by autonomic nerves. Okay, it is richly supplied by autonomic nerves, and remember these autonomic nerves forms a rich esophageal plexus. Esophageal plexus. Now when I say plexus, plexus का मतलब होता है बेटा bundle of nerves, nerves का गुच्छा. Yes, बंडल ऑफ नर्व्स और नर्व्स का गुच्छा बोलते हैं उसको, ठीक है। सो यस, cervical part beta. Now when I say cervical part, again, the cervical part, we have parasympathetic nerve fibers, parasympathetic and sympathetic. So can anyone tell me parasympathetic nerve fibers are coming from? Yeah, it is coming from the recurrent laryngeal nerve. The recurrent laryngeal nerve. Now I would give them, like I would give you a chocolate if you will tell me guys that this recurrent laryngeal nerve, it is like branch of which nerve? Yes. Sympathetic fibers is directly from the plexus, which is formed around the inferior thyroid artery, right? So yes. Vegas, Varun, Aditya, Anushka, Sushantika, Garima, Vicky. Chal, very good beta. Now coming on to the thoracic part. Thoracic also has parasympathetic and sympathetic part. Sympathetic part. So the parasympathetic part basically, yeah, it comes from the right and the left vagus. Okay, and the sympathetic part, it is splanchnic nerves. Okay, it is the splanchnic nerves and also the upper fourth ganglia. Yeah. Apart from that, remember beta, the third one, that is the abdominal part. Now the abdominal part also has parasympathetic supply and sympathetic supply. Now parasympathetic, it is from the anterior and posterior gastric nerves, and sympathetic, it is from sympathetic chain. I've already drawn the sympathetic chain when I was like yesterday when I was talking about, yeah, the relations. Okay, and yeah, we have the splanchnic neurons also over here. Splanchnic neurons. So that is something that you have to remember. The nerve supply of the esophagus, the lymphatic drainage, the arteries and the veins, which I've discussed in one slide, one diagram and one table. That's so simple. One slide I've like covered anatomy of the LES and what like factors are responsible to maintain it, right? Constrictions, parts, and now the last part of today's lecture, that is the clinical anatomy correlation. Now foreign body ingestion. Now beta, if foreign body is at level of C6, what you will do beta? Tell me. If the foreign body is at level of C6, what you guys will do? चलिए बताइए जल्दी से. I want to see how much your brains work. Hmm. चलिए नथिंग. एक्सरे, चलो ठीक है, एक्सरे से पता चल जाएगा. चल देखो, foreign body ingestion, this question has been asked multiple times in exams, so that's why this is an important clinical correlation that I wanted to discuss. Now beta, if it is at if it is impacted, if it is impacted at C6 of, okay, pharyngeoesophageal junction. Now what we will do, we will do endoscopic removal. We will do endoscopic removal. अगर C6 पर है, so what we will do, endoscopic removal. Okay, now अगर C6 से नीचे है, if it is distal to C6, if it is distal to C6 beta, C6 के नीचे है, what you will do, You will do, yes, एक्सरे वाला पॉइंट अब यहां पे काम आएगा बेटा. या you will do observation and observation, it is serial 24 hours x-ray, serial 24 hours x-ray. Now if foreign body is going down, if it is going distally, plus patient is asymptomatic, then you just have to observe. Nothing has to be done. If the foreign body is going distally, okay, and the patient is symptomatic, then again beta, you have to do endoscopic removal. Endoscopic removal. Now, here a question that has came in the exam that was regarding the button batteries. Now, my question to you, beta, if button batteries are present in this situation that I'm highlighting, if okay, now if someone has like ingested button batteries and he's having like this particular situation, the button battery is going distally and the patient is asymptomatic, then what you will do? If the button battery is going distally, it is going down and the patient is asymptomatic, what you will do? Immediate removal. Varun Kashyap says immediate removal. Why not? I will observe it. Why not? I should observe it. Why in case of button batteries? Why in case of button batteries I have to do immediate removal? Yes, it can corrode, yeah, and cause perforation beta. Even though it is present over there, okay, this should be removed immediately. Endoscopic removal should be done immediately. Yeah, the batteries beta, battery. Chalo, that was about the foreign body ingestion that you have to remember. Apart from that, if we talk about the GERD, gastroesophageal reflux disease. So you already know GERD basically stands for gastroesophageal reflux disease. Now, can anyone tell me gastroesophageal reflux disease occurs when? What is the pressure? Okay. Now, what is the length? David, hello. What is the length of the intra-abdominal pressure? Tell me. If the length of intra-abdominal esophagus, okay, if the length of the intra-abdominal esophagus, IAE, पूरा लिखिएगा, it is less than 2 centimeter and the pressure is less than 6 mm of Hg, then beta we say it is GERD. Okay, normal pressure कितना होता है? What is the normal pressure? It is 8 to 25 mm of Hg, right? If the pressure is less than 6 mm and if it is the length of the intra-abdominal esophagus is less than 2 centimeter, then yes. So there is an increase in the transient lower esophageal sphincter. Okay. Now, what are the clinical features? Sethi Usman, Aditya Narayan, very good, beta. What are the clinical features that you will encounter over here, beta? There will be heartburn. Heartburn कहते हैं ना, या फिर इसको रेट्रोस्टर्नल, छाती में जलन बोलते हैं इसको, रेट्रोस्टर्नल बर्निंग सेंसेशन will be there. Okay, it will be retrosternal burning sensation. Bad taste in oral cavity. Bad taste in oral cavity. खाना जा ही नहीं रहा है, ऊपर आ गया है. Bad taste in oral cavity. Okay. It can lead to pharyngitis also. Pharyngitis, laryngitis. And it can cause dental caries. It can cause dental caries as well. Now, yes, vomiting problem. Yeah, very good. Yeah, the normal clinical features. Now, without diagnosis, डायग्नोसिस पे दो क्वेश्चंस है. व्हाट इज द इन्वेस्टिगेशन ऑफ चॉइस? Investigation of choice. It is endoscopy. Endoscopy. And what is the gold standard, beta? Gold standard investigation. Sethi Usman, very good. Gold standard investigation. It is 24-hour pH monitoring. Okay. It is 24-hour pH monitoring. Okay. Endoscopy is, yeah, we will keep the pH probe like 5 centimeter proximal to gastroesophageal junction. Okay. And if the pH beta, if it is less than 4 means acidic ho jayega. And if it is less than 4 for more than 4% of time, like in a 24-hour period, if it is like 4% more time. So that is why the GERD is confirmed. So two questions, investigation of choice and the gold standard. Now, what management you will do, guys? Lifestyle changes. सबसे पहला आता है lifestyle changes. Avoid the food particles which relax the gastroesophageal sphincter, which relax the lower esophageal sphincter. Chocolate, fried food, fatty food, momos, spicy food, okay, the citrus foods, tea, coffee, ये जितना चाइनीज आइटम है सब पे बैन लगा दो. दैट इज द फर्स्ट थिंग दैट यू हैव टू डू विद द पेशेंट. और वो तो even you will advise the patient to take meal 2 hours before going to the bed. Take meal 2 hours before going to the bed. And moreover, you can use the prokinetic agents as well, right? PPI, proton pump inhibitors, as medicines you can give. Now, there are conditions where the person will fail to respond to medical therapy. And if there are like complications such as Barrett's esophagus, if it can result into the cancer or there is structure, then you have to do a surgery that is called as fundoplication. Fundoplication. Fundoplication, basically, it is a surgery where the principle of this particular surgery is to restore the length, intra-abdominal length of the esophagus, that is approximately 3 centimeter, right? So what we have to actually do, we have to tight the diaphragmatic crura. वो जो diaphragmatic crura था उसको पूरा बांध दो, ठीक है? और yeah, and we have to wrap the fundus around the esophagus. Yes, 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 yes. Very good. आजकल तो नए नए तरीके भी आ गए हैं ना. So there are like एंडोस्कोपिक रेडियो फ्रिक्वेंसी एब्लेशन भी है और एक लिंक्स डिवाइस भी है, प्री मैग्नेटिक बीट्स which we can like put around the lesser esophageal sphincter, or like कुछ polymers भी we can also inject endoscopically. So to these polymers actually they tight the sphincter. So yes, very good, guys. Very good. I hope this GERD is clear, like I've discussed in very short. Now, coming on to eclasia cardia. Now, beta, what is the problem in the eclasia cardia? I want every one of you to answer this in the chat box. What is the problem in the eclasia cardia? चलो जल्दी से बता दीजिए फटाफट से. हाँ. What is the problem in the eclasia cardia? Now, you already know that there is failure of relaxation of lower esophageal sphincter. Now, why there is a failure of relaxation? Because there is loss of ganglionic cells. Okay, loss of ganglionic cells in the myenteric plexus. Myenteric plexus. Okay, or it is also called myenteric plexus. Okay, now these ganglionic cells, they are derived from beta. They are derived from neural crest cells. They are derived from the neural crest cells, right? So these ganglionic cells are inhibitory ganglionic cells, and these inhibitory ganglionic cells, if there is a loss of these cells, okay, what will have? The LES will not relax. Okay, the LES will not relax. Now, what are the problems that you will find? What are the problems that you will see in the patient? Yeah, the patient will have regurgitation. Okay, the patient will have regurgitation. It will have dysphagia. Okay, it will not be able to swallow initially to liquids. Yeah, difficulty in swallowing will be there. Yes, it will have bad smell in the mouth, halitosis. Okay, and yes, so that is something that you have to remember. One important thing that you have to remember over here on barium meal. Yeah, so on barium meal, you will see a bird beak appearance, beta. A bird beak appearance. Okay. So on barium, basically we will see a bird beak appearance that has been asked in exam multiple times. Bird beak appearance. Okay. So that is something that you have to remember. Management, beta, you can like give him calcium channel blockers. Medical management you can do. Okay. Endoscopic management. Yeah. Hmm. And we can do surgery also for the same. Surgery also for the same. Yeah, it is associated with Chagas disease. Yeah, beta, it is secondary eclasia, Vicky Chaudhary. It is secondary eclasia cardia. We have actually three types. We have actually three types: primary, secondary, and tertiary. The secondary one, it is seen in Chagas disease, and this Chagas disease is due to Trypanosoma cruzi infection. Okay, so yeah, the third one, yeah, it is vigorous eclasia. Primary one, it is the loss of the aganglionic cells that I've already told you. This is the primary eclasia which I'm talking about. Secondary one, it is seen in Chagas disease, and third one, it is like the vigorous eclasia, rapid progressive eclasia. Yeah. Heller's myotomy, we will do very good, beta. It is the surgery that we can do, which I think Surveen has already mentioned. We will do Heller's myotomy. Yeah, Heller's myotomy. Right? We have to cut the muscle 5 centimeter proximal. Okay, what we do in this Heller's myotomy means muscle ka cut karna. So we cut the muscle 5 centimeter proximal and 2 centimeter distal to the gastroesophageal junction. Okay, so yes, sure. I hope the clinical situations are clear to everyone. The three I have discussed in very less information, but that is the most potent one, and that you have to remember for the exam. We have discussed the nerve supply of the esophagus, the lymphatic drainage. We have discussed the arterial and venous supply in one particular slide. Okay, with the diagram and with the table. Apart from that, the anatomy of the LES, the lower esophageal sphincter, the upper esophageal sphincter, the constrictions of the esophagus, the parts of the esophagus, the length, beginning, and termination. I hope today's lecture is clear to each one of you guys. So just give me a thumbs up in the chat box if you understood the lecture well. And tomorrow I will be very good. Aditya, very good. Sanjana, Anushka, very good, beta. I hope everyone is studying. Yeah, everyone is making the notes, writing the notes along with me. All the diagrams which I'm drawing, Kriti, Vicky, Surveen, Kapil, Usman, beta, beta, you can text me if you have any doubts. You can text me on this particular number as well. This is my number, and you can put your doubts over here if afterwards you have something. If you have something now, you can just go for it. Kriti, very good. Garima, Ishraq, very good. Very good. Yes. So if there is any doubt, just let me know. Okay. Thank you, beta. God bless, and please do attend the sessions daily. Do attend the sessions daily. Right. Bye. Bye.